America Adidas, right now in Kamuli district at Mase Medical Clinic, and we are trying to orient you in what is happening in our unit and see what's happening and what we do inside. And here is the laboratory. And the lab man is here. Mister, how are you? Hey, can you talk about yourself?
Okay, I'm Chargam Bashir, the lab technician.
Oh,
Yeah.
thank you. How is everything around? Is this okay for this place?
No, as
Is the space now?
the space is not enough. Yeah, we need the more space so that we ease and our services for the lab. As you know, the standards of the lab, this does not meet the standard. The space is a little small. We need a bit bigger. We need the ceiling. We need everything, even the equipments.
So okay,
we still need more.
Good enough here is our in church attending to the patient. She's by the names of Angel. So Angel can tell you more about this place and how he feels about this place. Yes.
Yeah, nurse acting Angela, working with the Mase Medical Clinic. Yeah, this place is very good and we receive many patients, but the place is very small, no ventilation. The ventilation is not well good, and sometimes we don't have enough. The reception is not enough. Sometimes you receive patients here seated and others are waiting from outside, whereby this bench can't afford many patients we receive, because the maximum of patients we receive a day on treatment, there are maximum of 20. Patients are waiting from outside to get treatment to come in here, but the place is very small, so we don't have place where patients sit to get treatment, whereby we need a very big room where patients can sit as they are waiting to be worked upon.
What other challenge do you have as a medic, as a nurse?
Yeah, sometimes this room is only one where we receive mostly. This is a place when someone has got an accident, we receive them from here. So in the moment you have a patient there is getting treatment, but again you've received a client who has got an accident.
The casualty? Yes,
the casualty has got an accident. So in the process, you want to attend this one and you want to attend to the other one, but the room is very small, it can't afford all of them. So we need at least any other big room where we can receive those patients who are coming immediately, as the others for treatment are waiting.
In terms of the space outside and inside, what would you say as your experience from your stay here?
The place is small.
The wards
are very small, because according to the patients we receive every day, the wards are very few. So we need at least a very big site where patients can come in and can be attended to.
Like I've already told you, we bought land. Here is it. Meet my colleague, Mr. Dennis. We are orienting you with Mr. Dennis. Please, let's go ahead.
So, Mr. Director,
Yes, sir.
we are here on to the site to which you want to build a state-of-the-art hospital.
Siren.
I had you call on to the well-wishers, the supporters, the churches to come in. What kind of the state-of-the-art hospital do you want to construct on the site?
Yeah, thank you, Mr. Dennis, for such a good question.
Yes.
What I would love to put on this site you are seeing here, I want to put an emergency and accident ward.
Yes.
I want to put a good laboratory.
Yes.
I want to have an investigation room with an ultrasound scan, X-ray, and a CT scan.
Yes.
I would also have need to have a pediatric ward.
Yes.
I also need to have a maternity ward. I also need to have a theater where we can operate patients from. I also need to have a rehabilitation room. A rehabilitation room, a room where people with problems from community can come, and then we counsel them, and then solve their challenges.
Yes. Thank you so very much, Mr. Director. Now, according to your explanation, from there you're seeing close to 20 patients each day. That is close to 600 a month. How many, after this facility has been put in place, how many patients will be able to see in a month?
Oh wow. Yeah, you know, up the other side, every day we are able to see like 20 patients a day.
Yes.
And we believe if we see like now 60 times 20 times 30, that is 600.
Yes.
So that means every month here we are going to double.
Yes.
We are going to double like
1,200.
Yeah, like around 1,200
patients.
Yeah, a month.
Yes.
So we are going to create a very big impact if this place is constructed. The site, as I speak, it is 110 feet by 225 feet.
Yes.
And that is enough space to accommodate. This is enough space to accommodate a hospital as I speak.
Yes.
We need well-wishers.
Yes.
Yeah, to support us in the mission.
Yes.
If I can take you back from where I grew up.
Yes.
You know, when I grew up as a child, I often fell sickly.
Yes.
And most times I was taken to hospital.
Yes.
And I would be carried by my mother in the back.
Yes.
To a hospital. My mother could travel like 5 kilometers from home to hospital.
Yes.
But now when I could reach in the hospital, I used to meet their nurses who could give me a lot of good impression.
Yes.
They could attend to me nicely. I recall one time I met an American, I met a white lady. Maybe it was an American, I didn't know. I was a young boy. And this lady could really give me a lot of care, would give me sweets, hug me, give me drugs. I would feel at home. So now, when I grew up, then that dream of becoming a medical profession came into my mind, and I used to tell my mom, I'll be a medical doctor. I'll be a medical doctor, and I also construct a hospital like this one where people are getting services from.
Yes.
So it was luck that I was lucky that my parents, being the fact that they were poor, they afforded to take me to school, and I managed to study a course. I managed to study a diploma in nursing.
Yes.
And so after completing a diploma in nursing, I now started seeing my dreams coming true.
Yes.
I first of all worked in a clinic, in someone's clinic in a remote village.
Yes.
Where I was paid 140. How many dollars is that?
140. Those are
around $5, if I can speak. And now from there I acquired some skills.
Yes.
Of how someone can start a hospital.
Yes.
Of how someone can start a room to another room.
Yes.
That's where you see behind, after experiencing challenges in the hospital where I met a child dying.
A business scholar would say you did what they call due diligence of who, how, when. Yes.
Yes. So now I acquired that experience.
Yes.
But when I happily meet now a child in a hospital.
Yes.
Dying on a line. In fact, the child died on a line waiting for medical services in a hospital in Eastern Uganda.
Yes.
And I was like, no, this can't happen when I've qualified.
Yes.
And I had to think of starting this medical service, and I put it in practice that I must buy land and construct a place where I must be managing people who are suffering, so that will reduce on the mortality rate in the country. And today we are here. I bought this land where you are seeing, and we want to put a hospital that I was dreaming about. So I feel this place should be the best in the Eastern region. I feel this place should support a mother, should support a child.
Yes.
So that will reduce on the mortality rate, you know?
Yes.
Because when you try to look around the hospitals here, people travel long distances.
Yes.
Government is doing a lot it can.
Yes.
But there is still a very big gap
Yes.
that we need to address. And I'm here, please,
Yes.
to do this.
Yes.
Yeah. So if supported, I'm here.
Thank you so very much, Mr. Director. As you are seeing, this land covers 110 by 225. In the width is 110, and in the length is 225. Mr. Director wants to put up a state-of-the-art hospital here, so that he may try to bridge the gap between that have been in the medical services in Uganda. So, Mr. Director, I want you to tell the viewers, after this dream has been achieved, how you will help government to reduce onto mortality rate, curb the situation of medical issues in the country.
Yeah, like now, when you try to look at already the current hospitals we have,
Yes.
these hospitals receive some medications from national medical stores.
Yes.
But sometimes medications are not enough.
Yes.
Some people come in a hospital and they fail to get medicines.
Yes.
The doctor writes for them, after writing for them, and they don't get medicines.
Yes.
But as I speak here, we shall even be providing free medical services
Yes.
to some of these people where our drugs will be available. You'll ask me a question, how will you be getting some of these drugs?
Yes, that would be the question that would be posed.
Some of these drugs we shall be using some of our profits we acquire from some of the procedures.
Hold it there, Mr. Director. Does that mean that you're going to be giving free medical services to all people, all those who are marginalized, like the elderly, like the people who are not in position to pay bills for themselves? Will this free medication you've mentioned going to be for all people, all caliber of people, all those people who are, probably stricken?
Yeah, this is going to be, we are going, of course, we're going to reduce the costs.
Okay.
To the lowest cost, like a cost where a human, a local person can afford. But the very poor ones will be getting purely free medical services. Like the surgeries will be for free. The hospital will be caring for free surgeries for medical for very poor people. We shall be offering free services for very poor mothers to afford a cesarean section.
Yes. I want us to end this interview because it's very intriguing and so interesting. Mr. Director has many things to offer. He wants to just call upon you people to support him, stand behind him, so that his dream can come true. You've heard, he has mentioned he's going to be giving free services to those people who are less privileged, people who are in situations like those he mentioned. And here we are. He wishes to give a conclusive remark by asking for your support. Mr. Director.
Yeah, so to all viewers viewing me,
Yeah.
The organizations around, the foundations,
Yes.
donors,
Yes.
churches, individuals,
Yes.
friends, and all well-wishers.
Yes.
Please join me in this mission and have a constructed place here,
Yes.
where it is self-reliant,
Yes.
where it is having enough wards, enough rooms, enough areas where doctors can sleep,
Yes.
enough areas where nurses can sleep.
Yes.
And then we support our community. Thank you so much.